Welcome, welcome. Today we're diving into a topic that plagues more women than you can even imagine. And it's one of the most common yet least spoken about struggles that midlife women face. Bladder leaks, urgency, frequency, nighttime peeing. These are things many women are too embarrassed to mention even to their doctors. So I really admire our guest today, pelvic floor physical therapist Lindsay Geddes, who helps women overcome these issues for good. Welcome, everyone, to the Better Beyond 40 Formula podcast, where smart, driven women over 40 and those who support them can ditch the confusion and cut through the midlife wellness nonsense. I'm Dr. Mary Pines, award-winning biomedical scientist of 25 years with a decade in women's health and longevity consulting. Today, we're welcoming the lovely, the brilliant Lindsay Geddes, a Canadian pelvic floor physiotherapist, best known for helping women stop bladder leaks, urgency, frequency, and nighttime peeing without surgery, medication, or complicated exercise. With over 20 years in health and wellness, Lindsay brings a rare breed of orthopedic and pelvic health expertise. So cool. And she uses a whole body approach to uncover root cause issues that many providers miss. So, Lindsay, it's a real pleasure to have you on the show. Welcome.
Thank you so much, Mary. I'm so happy to be here.
Awesome. I'm excited about this conversation. So, diving into your world, which is, I have to admit, something I know not very much about. I would love to really just start off on a high level. Tell us all what the pelvic floor actually is.
Well, excellent. I'm going to back you up even farther, and let's just talk about what the pelvis is. I've got my trusty model here. So the pelvis is made up of 3 bones. You have a bone on the right, a bone on the left. So when you put your hands on your hips, you're actually putting your hands on your pelvis. You can tell all your friends. If you turn this person around, the 3rd bone is this triangle-shaped bone at the back called your sacrum. If my fingers were in your bum crack and I walked down to the tip of your tailbone, there's your tailbone there. Turn this person back around. If we sat on baseball bleachers or a bike seat all afternoon and your sits bones get sore, those are your sits bones here. So that's your pelvis. If your finger was in your belly button and you walk down to the bone beneath of it, that's your pubic bone here. So that's your pelvis. If I tip this pelvis forward, you can see all in the inside here that it's this beautiful bowl shape, which I think is pretty cool because it houses a lot of things. So if we start on the outside, we've got your vagina, which leads to the inside tube of the vagina that then reaches to the cervix, the uterus, fallopian tubes, and ovaries. You have the urethra, and on the inside, it goes to the tube of the urethra, the tube where the pee comes out. That leads to your bladder. And then we also have your anus, which leads to your rectum, the place where your stool is stored before a bowel movement. And the rectum and some of your colon, the end part of your intestines, they all sit in this pelvic bowl, all here.
That's a small bowl. And I hope that you're watching this, audience, on YouTube, because it's really cool. It looks like it's too small to hold all that stuff. That's amazing.
So the pelvic floor is the bottom or the floor of this bowl shape. A lot of people, when they hear pelvic floor, they actually think that we're only talking about the muscles. There are 3 muscles that make up the pelvic floor. Yes, that's all the red things that you can see if you're watching the video here. But the pelvic floor is also made of things like connective tissue, fascia. A lot of people have heard of that word. We also have blood vessels, so arteries and veins. We also have nerves. And then ligaments, which connect bone to bone and suspend some of the pelvic organs up inside of the body. So the pelvic floor, when we think about it from an anatomy standpoint, is all of those things that we talked about. However, in a lot of contexts, when people say pelvic floor, we're actually talking about the muscles themselves.
Interesting. I love this. I love it. Really helpful, actually, to have the visual on it, too. Thank you for walking us through that. in my world, I'm talking about perimenopause and menopause and all of those hormone changes that happen. And I'm curious, like, and in your world, you're dealing with the tissue level changes very specific to this region of the body. So I'm just curious, how do perimenopause and menopause affect the pelvis or the pelvic tissues?
Yes, great question. And I too have a lot of women come into my world being told that all of their issues were caused by perimenopause and menopause. And as you'll hear in a moment, that change in hormones over time can definitely influence these tissues, absolutely. But let me tell you, it's often uncovering things that were happening long before the perimenopause menopause phase started. So let's just talk about the changes that we know that can happen in
Yeah,
perimenopause and menopause. As we
great.
age, we start to lose muscle mass. And that doesn't just go to your biceps or your quads, it's everywhere in the body. So the pelvic floor muscles as well start to get a little bit smaller. We call it atrophy. So they get smaller in size. We also have a reduction in blood flow to the area, which, if you're not getting as much nutrition to muscles and you're already naturally atrophying, they can get smaller a little bit faster than other muscles in the body. We also know that the tissues of the pelvic floor, as well as the vulva and vagina area, they start to thin out. Their deep cellular matrix, so their deepest setup of their tissues, gets a little bit thinner and a little bit more sensitive to things like friction, to things like pressure. So sometimes intercourse becomes uncomfortable, even touch in that area, but even things that are not sexual related, things like wearing
Mm.
jeans, going on long walks, riding a bike, maybe horseback riding. Sometimes women will say to me, these things have now become uncomfortable, even though they never were uncomfortable previously. That is also potentially linked to the decrease of lubrication in the area. So, as we go through these hormone changes, we're producing less lubrication. This will particularly show up if we are having intercourse, but again, just by wearing clothing it can be uncomfortable. So those are some of the big changes that we see in that area. Now, if you head into perimenopause and menopause, actually, let me tell you about one more really important
Please.
one, actually.
Yeah.
So, our hormones really help feed, particularly estrogen. They really help feed the good bacteria in the vagina and the urinary tract and in the bladder. And so when it feeds that good bacteria, that army that we want defending us from all the foreign bacteria, the bad bacteria, we want that army to be as big and robust as possible. As we go through perimenopause and menopause, our lack of estrogen or reduced estrogen means that those good bacteria are smaller in number, which will make us more sensitive to urinary tract infections and also more sensitive to just urethra sensitivity. So, again, it's not just that dryness that can create that urethral sensitivity, it's the lack of that good bacteria and just the more sensitivity of the walls. And so a lot of women come to me saying, I really don't have a lot of issue with urgency or frequency or leaking, except for when I'm walking. And so some folks think that this is only to do with the muscles that are being used in walking. And yes, maybe it is, but we also have to consider that it could be that urethral sensitivity as well. But let me just tell you, all of that does happen slowly and gradually over time. And I will admit, sometimes it happens really fast and furious for some women and maybe a little bit slower or less obvious for others. But if you
Certainly.
go into that phase of life already having a dysfunctional pelvic floor, and I just used air quotes with my fingers there if you can't see me, then these changes in perimenopause and menopause are going to be a lot more dramatic. And so, what is this dysfunction that I talk about? The pelvic floor muscles, they need to be like Goldilocks. They can't be too tight, they can't be too loose, and they also need to be doing the same thing on the left and the right side. A lot of women don't know this, Mary, because we're not taught these things about our own body, but some of the pelvic floor
Oh my
muscles
God, totally.
reach out of the pelvis and they attach onto the leg bone, which means some of the pelvic floor muscles are
Okay.
also hip muscles, and some of the hip muscles are also pelvic floor muscles. And because you can be doing
Interesting.
something completely different with one leg versus the other, you can be doing something completely different with one side of the pelvic floor versus the other. So if you've ever had a leg or foot injury, bunions, Morton neuroma, ankle sprain, plantar fasciitis, calf issues, knee or hip arthritis, pain, essentially anytime that you've had to limp, this is going to guarantee that you have a lopsided pelvic floor. And a lopsided pelvic floor is not going to support the bladder in the way that it likes. And it can't wrap around the urethra, the tube where the pee comes out, properly in order to close it and keep it closed when we want to. Because the pelvic floor muscles will help bladder control by two big picture reasons. For one, it supports the bladder, it supports all of the organs. And sometimes when the bladder gets a bit bossy, and when you get a bossy bladder, it's very sensitive. It becomes like Princess and the Pea. It wants a perfect mattress. It can't be too stiff, it can't be too loose, and it can't be lopsided on the other side. And so these types of dysfunctions can make the bladder more sensitive, more frequency, more urgency. And then on the
Wow.
other hand, if we also have that lopsided pelvic floor that can't keep the tube closed very well, then what happens is that we can get leaking associated with these things as well.
Super interesting, Lindsay. Wow, that was a major download. I'm still processing a lot of that. That's incredible. So basically, I'm gonna hear what you said as any woman is potentially at risk for pelvic floor issues if she has any kind of asymmetry, like athletes, someone with an injury. I would assume that women who've had babies probably fall into the higher risk category. And we talk about perimenopause and menopause, but it sounds like younger women probably quite often have these issues too. Like what's the sort of prevalence in younger women versus older women, or if you had a rough idea?
Yeah. Well, I mean, if we just talk about leaking, 50% of women will have some sort of leaking at some point in their life. And when we
Wow.
look at overactive bladder, which is when you have a lot of urgency, a lot of frequency, and plus or minus some leaking, we can say
Okay.
that postmenopausal women, up to 30% of women can start to have that. So yes,
Wow.
the hormone changes can impact that, but it's not just women who are postmenopausal. It's not just women who have had pregnancies, labor, and delivery. The muscles of the pelvic floor are just muscles. They are not magic. Sometimes they can be involved in magic, but they are not magic. If you took them underneath of a microscope and looked at them, they are the same structure as other muscles in your body. They do not live in a different realm where they follow different rules and they do different things. They are just muscles. And so if you have an injury to your body that impacts those muscles, or a habit, or
Mhm.
a way that you always sit or always stand or anything like that, it's going to impact those muscles, regardless of whether you've had a baby or not. And so it's not just reserved for perimenopause, menopause. It's not just reserved for women who have had labor and delivery, because I will tell you that I have worked with so many women with lots of different pelvic floor dysfunction or bladder dysfunction, and they come in all ages, in all opportunities of whether they had pregnancy, labor, and delivery or not, whether they've had injuries or not, whether they are in
Mhm.
perimenopause or are postmenopausal.
Okay, super interesting. Good to know. And so, wow, yeah, fascinating. And in terms of the women who are in my audience right now, most of them are in midlife, maybe perimenopause or menopause, postmenopause. What are the most common pelvic floor issues you see in this population of women?
Mm. I would say when I see women in this population, the number one things are pain with intercourse or just discomfort in their vulva in general, and a reduction of sensation for orgasm or pleasure in that area. That's definitely a very common one. That can also be
Mm.
paired with like a sense of dryness or chafing in the vulva vaginal area. Also, this is a time where bladder issues start to come up. So, increased
Mm.
frequency of leaking, urgency. I just can't make it to the bathroom on time. I'm waking up multiple times per night to go pee. So, bladder issues start to creep up around this time commonly as well.
Oh, totally. I get women asking about whether it's normal if they leak a little bit when they're, jumping in fitness class or that kind of thing. Is that normal, Lindsay?
Essentially, unless you are sitting on a toilet or squatting over a squatting toilet, or maybe squatting in the bush if you're out for a hike and you want the urine to come out in those places, urine should not be escaping your body for any other reason. So if you jump, laugh, cough, sneeze, and you are getting some leaking, that is not considered normal. Is it common? Yes, as we talked about, up to 50% of women are going to experience leaking at some point in their life, but common is not the same as normal. So, common is, yes, a
Okay.
lot of people have it, and so I'm not going to go screaming and running through the hills. However, normal means that we can change it. It's not something that we should expect. It's not something that we should just sit back and, live with or not try to change, because there's definitely a lot of things that we can do to change that.
Amazing and great answer. Yes. Nor common does not mean healthy or good. So, yeah, perfect answer. And you mentioned actually, just going back a second, the pelvic floor can be too tight or too weak. How does a woman know if her pelvic floor is too weak or too tight, or if she has an issue there?
A lot of the signs between an overactive or too tight and an underactive or too weak are actually crossover. So, what's really interesting is that at some point in history, I can't pinpoint when, women were told that if you have any issues in your pelvic floor or bladder control, then the problem is that because you're weak, and to be able to strengthen it, you must do Kegel exercises. But here's the
Yeah.
thing, if you actually have an overactive pelvic floor that's too tight, or a lopsided pelvic floor, Kegels at best are not going to do anything. Worst case scenario is that they're actually going to make your issues worse. And this is what I see a lot in the women that I work with. Because when you have urge incontinence, overactive bladder, a lot of frequency, urethral sensitivity, you are way more likely to have an overactive or tight pelvic floor than you are to have an underactive one. So, if you have leaking, urgency, frequency, even sensations of pelvic organ prolapse, which is when the pelvic organs just migrate and sit a little bit lower down into the vagina than they used to, these sorts of things, or night peeing, all of those could be a tight pelvic floor, or they could be a loose pelvic floor. And this comes as a big surprise because a lot of women are really told that it's because they have a loose or weak pelvic floor. So that's when we have to start digging a little bit deeper to find some other ways that we can figure out what are some other signs that you could have a tight pelvic floor. So if you have constipation, so that is a key indicator. So the pelvic floor muscles don't just wrap around the vagina, they wrap around the rectum as well. So the rectum is where the stool is stored. And when they wrap around the rectum, they create a kink in your rectum. We all want a kink. I have a kink, you have a kink, we all have a kink. We want that kink because as we're standing up, it means that that rectum is a little bit bent. And that way, we're not just relying on the anal sphincter, we're relying on that kink and the rest of the body to make sure that the stool doesn't migrate down when we're not ready for it to. If
Thank
our
goodness.
pelvic floor muscles are overactive, what happens is that it creates a more of a kink. So that kink is a more acute angle, which means when we sit down on the toilet and we're supposed to be able to relax our pelvic floor muscles, they can't fully relax. It can't fully unkink that tube. And then it's harder to pass the stool. So it feels harder to pass, so more straining. And also, if it's harder to pass, we may have some incomplete evacuation. Some stool is left behind. The longer it sits in our body, the more time our body has to remove the fluid from it. It becomes drier, more hard packed. Then we try and eat more fiber because that's what everybody tells us to do. And then it actually just backs us up
Yeah.
even more. So constipation
Right.
is definitely a sign of an overactive pelvic floor.
I love that you tied that together. Amazing.
Yes. Another sign that you could have a tight pelvic floor is pain with intercourse. So, yes, it could be a friction thing from lubrication and a thinning of the tissues. Yes. But tight muscles are painful when you poke them. And when we have
Mhm.
intercourse, there's a lot of pressure, movement, and pokes in those areas. And if it's painful in certain angles more than others, this is a key sign that you may have some overactive pelvic floor muscles. And some other really easy ways to know would be, are your hips painful or stiff? Do you get tailbone pain? Do you get low back stiffness or pain, or maybe lower abdominal discomfort or tension? All of those things can be pointing towards a pelvic floor that's too tight or overactive.
Really, really amazing. Thank you for drawing our awareness to those things that, yeah, one wouldn't necessarily expect to hang together. That's really good info. Thanks, Lindsay. And in the world of therapeutics that you offer, because it is a world, you're so skilled in many ways. I'm curious how your work like how would you approach these kinds of problems? And specifically, I wonder, can pelvic floor physiotherapy help with things like painful sex or vaginal dryness, or is that just about hormones? And similarly with some of these other issues, is this a physical thing that you can get into with physiotherapy, or do you use adjunct therapies as well?
Yeah. Oh my goodness. So many great
Big
questions all
question.
rolled up into one. First of all, I'll say that all of these things absolutely can be helped with pelvic floor physical therapy or physiotherapy, as we say here in Canada and the UK and Australia. So, to start with pain, absolutely. You make those muscles happier, they will not be painful anymore. If your pain is coming from the chafing and the lubrication, we think that perhaps maybe doing some sort of movement or maybe release around those muscles that helps increase the blood flow to that area can restore some of that good lubrication in the area. However, if your discomfort and lubrication is highly linked to a phase of perimenopause or menopause, and you have other signs of perimenopause and menopause, I highly recommend using a product like vaginal estrogen to help restore those tissues because it's beautiful at helping with lubrication and pain with intercourse. We also know that the use of vaginal estrogen is really helpful for urge incontinence, urgency, and frequency, as well as reducing the risk of urinary tract infections and reducing the hospitalization when we do have urinary tract infections. I won't dive deep into it, but the older we get, the more different that urinary tract infections impact us. So when we're young, we all know when we have a urinary tract infection, it
Mhm.
hurts, it burns. I have to pee a lot. My abdominal muscles or my abdomen, sorry, hurts. But when we're older, what happens is it kind of skips all that and it
Hmm.
starts to show up as like an acute delirium. So a lot of family members think that
Really?
their family member has maybe had a stroke because it happens very suddenly.
Oh,
Sometimes it's paired with a fever. And so when they're
huh.
admitted to hospital, they will get triaged to let's test this for a UTI and let's see if this is a stroke. And very commonly it's a UTI. We treat it with antibiotics and the delirium goes away. Unfortunately, what happens is that in some folks, that delirium never goes back to pre-episode status. So we retain some of that dementia, that acute dementia. If it
Oh,
gets layered
wow.
one after another, this is how these chronic and recurrent urinary tract infections can be linked to ongoing dementia as well.
Oh,
So,
that's crazy. Huh.
mhm, mhm. So that's
Interesting.
the adjunct use of estrogen. But I want to just again zoom out and tell you that doing local activity, exercise, maybe release techniques, stretching absolutely can help the local muscles there. But remember how I said that
Amazing.
these muscles are not magic. They're not
Yeah.
magic, and they're also connected to the whole rest of your body. The pelvic floor and the bladder, for
Amazing.
that matter, do not live in a closet and operate all by themselves. They are connected to the rest of your body through muscles and fascia and nerves and blood flow, but also to biomechanics, to gravity, hormones, memories. And so,
Mhm.
how you move in one part of your body will absolutely impact how you move to in another part of the body. And so, this is a key unique feature of how I work with my women. I make sure
Mhm.
that we are addressing all of the other areas of the body that are really influencing how the pelvic and the pelvic floor functions. Not just in muscles,
Amazing.
but in the nervous system as well. What is that brain bladder, brain pelvic floor connection doing? Because a lot of the time, especially if we have that sudden urge when you're trying to get your key in the front door, when you've just parked your car, when you're getting ready to get in the shower, when you're hearing, seeing, or feeling running water, all of these things, your bladder and your pelvic floor do not have eyes or ears. They do not know that you're at your front door. They don't know that you're just feeling the water, but your nervous system can. And that is another huge differentiator about how I work with clients is that we
Mhm.
address all of the root causes, not just those small muscles that surround your vaginal opening.
That's amazing. And I love that so much. I'm excited to actually provide all of our listeners with resources on how they can find you. And Lindsay, I love this work. It's amazing and essential. I'm aware that we had just a few minutes left before I get you to tell people where they can find you. Is there a couple of maybe just simple strategies that you can leave us with today that people could take home with them?
Absolutely. So, again, on the theme of not all pelvic floor muscles are too loose, a lot of them are too tight. But even if they're sitting in the middle there, everybody would really benefit from learning how to fully relax their pelvic floor as well as how to contract. I'm also going to take off this veil of mystery because then a lot of women are like, I don't know if I'm doing my Kegel correctly. And the thing is that it's pretty hard to do incorrectly. The biggest problem I see with women is that they can't relax. And so when they go to contract, they're not really contracting. They're kind of just like half clenching or something like that. So we could all do it
Okay.
together. If you just sit on whatever surface that you're currently sitting and maybe rock back and forth and find your sits bones, your left one, your right one. If you rock forward towards your clitoris or your pubic bone, there's the front. If you rock back towards your anus or your tailbone, that's the back. You've kind of mapped out this triangle or diamond shaped. So let's just start with a nice, beautiful 360-degree breath in. If you're watching me on YouTube, you can see my beautiful little toy here. It expands in all directions. That's the direction that we want to send that air. So if you just start with taking a
Mhm.
slow, deep breath in, send the air to the top, all the way down to the pelvic floor, around the sides and back, and then we just relax the air out. Let's do that again, but feel what's happening underneath of your sits bones on your pelvic floor. So when we inhale, you should feel that the pressure changes at your pelvic floor. And if anything, you might actually feel that it increases because when we inhale, we want the pelvic floor to relax down into the chair. Great, let's do that one more time. We're going to inhale 360 degrees, let the sits bones go wide and the pelvic floor soften, and then relax the air out. Okay, let's try a Kegel on the exhale this time. So we're going to inhale 360, everything expands. And on your exhale, just see if you can contract the muscles around your vagina like you're trying to stop the flow of pee. And then inhale and let them fully go. Exhale, see if you can contract, maybe even thinking about flexing or nodding your clitoris. That can be another way to get those muscles. And then inhale, let it fully go. Now, if you felt something at your pelvic floor, if you felt some movement, a pressure change, you're doing it right. You are doing something that's going to be helpful. So everybody could practice this.
Awesome.
The only time I would suggest not practicing this is when you're on the toilet. The toilet is for relaxing your pelvic floor, not for contracting, but you can try this in any position. But sitting on a chair at the beginning might be helpful for that feedback.
Beautiful. Wow, that's so great. Thank you, Lindsay. I'm going to go and practice that later. And I'm aware that we're out of time. So, for all the women who are like, oh my God, I need your help, can you tell us where people can find you? I will also post it in the show notes.
Yes, absolutely. So I'm slightly active on Instagram, hoping to get a little bit better this year. You can find me at Lindsay Geddes PT. I also have a free Facebook community that Dr. Mary Pines will put the link to. And I also have a link to a free masterclass about how I work with women with bladder leaks, urgency, frequency, and night peeing. So you can absolutely have a listen there. And if you go to any of those places, you will see how you can connect with me directly. I would love to answer any of your questions.
Thank you. Yes, you're amazing, Lindsay. Thank you so much. I've read some of the stories on your website, women who've come through your program, and they are awesome. So yeah, not something you want to stall out on. You want to like get all this on track. This pelvic floor health is so important, my ladies. So call Lindsay. She can help you. Thank you so much for joining us today. It was a real delight.
Thank you so much, Mary. Thank you for what you're doing. It is such an important area of work, and I am so excited to be working alongside you in that area.
Thank you.
Okay. Bye-bye.
All right, my friend, if you loved this episode and want more support, resources, and some laughs along the way, you can also visit my website, drmarypines.com. Check out my acclaimed Better Beyond 40 program, and make sure you're on my newsletter and in my free group on school. I offer some real goodies there. You can also find me on Instagram at Dr. Mary Pines. Until next time, thank you so much for listening. I appreciate you and the journey you're on. We're in it together.